all the patient safety nodal officers who have joined in from various medical colleges and faculty, uh, including the faculty as well as residents, nurses, and healthcare professionals. And today, I think we are in this National Capacity Building webinar series, 11th webinar. This is the 11th webinar. And today's topic for discussion is related to feedback and grievance redressal mechanism for patient safety. I think any activity, if all the objectives and outcomes have to be achieved without the significance given to feedback and grievance, it is incomplete. And a well functioning feedback and grievance redressal mechanism is definitely vital for any healthcare system, because in any service delivery setup, if we are not able to address the concerns of the people who take our services, then the gaps cannot be covered fully. With that, it also is empowering for the patients and caregivers, and of course, the service providers also get insights into identifying the gaps or preventing errors and improving service delivery. Apart from this, of course, it does help to build up a uh, transparent, patient-centric ecosystem for health. With these few words, without taking much time, I would like to welcome today's eminent speaker. We have Dr. Pranita Madam from AIMS Raipur. Madam is Associate Professor in Department of General Medicine, and um, she has been proactively involved in quality improvement and patient engagement initiatives at AIMS Raipur. And of course, with her wealth of experience in clinical and institutional grievance mechanisms, it shall be helpful for us to understand this and how we can move forward to ensure accountability of our healthcare institutions. So, over to you, madam.
Thanks for your kind introduction, sir. Am I audible, sir?
Yes, ma'am, you're audible.
Slides are visible, sir?
Yes, ma'am.
Okay, good afternoon, everyone. At the onset, I would like to extend my sincere gratitude towards Patient Safety Secretariat team for organizing such an insightful webinar on feedback and grievance redressal mechanism for patient safety. The deep commitment towards enhancing the patient safety culture across all in India by sharing our best practices and emphasizing the importance of feedback and grievance redressal mechanism for patient safety is really commendable. Today, I will be presenting the topic on feedback and grievance redressal mechanism for patient safety. And the key objective is to emphasize the importance of feedback and grievance redressal for patient safety in healthcare, and to define what is actually the feedback and grievance and what are the categories of grievances, and how this grievance redressal, the process, what is the process, and what are the challenges which we face while addressing these grievances. So what is the importance of feedback and grievance redressal for patient safety in healthcare? If we see, there are 5 dimensions of patient safety in measurement and monitoring, which is actually a quality care for the patient. First is the past harm, reliability, sensitivity and operations, anticipations, and most important is to involve the patient in the form of feedback, because the main beneficiary of a good healthcare system is clearly the patient. So information actually derived from patient's experience is the feedback, which is critical for ensuring quality services. So Prompt complaint resolution is which is improves healthcare quality and increases patient satisfaction. Better patient satisfaction will lead to improved compliance and clinical outcomes. Patient feedback is crucial for enhancing healthcare services and creating a better working environment for professionals. And there are three ways by which we can gather the feedback, that is community-based monitoring or external surveys or by internal monitoring. So there are various ways by which we can collect the patient feedback in the form of, we can collect by surveys and questionnaires, focus groups, comment cards and suggestion boxes. The online reviews and social medias can also help, and by direct communication, which is mostly seen in our settings. What is the objective of this grievance redressal mechanism? How we strengthen it? To have a robust, efficient, and effective grievance redressal system dedicated to improvement of healthcare services and satisfaction of the patient, to form a health system that is more responsive to the health needs of the community. So we have to address the health needs of the community according to their requirement, to provide a platform for the beneficiaries to communicate their grievances to appropriate authorities, to reduce the delay in the provision of care by prompt responses to those grievances, to encourage the public and users to offer suggestions to improve the functioning of the hospitals, and ultimately their suggestions can change the functioning of the government health situations and to monitor the improvement in the performance of the situations overall. So what is actually grievance? Any complaint expressing dissatisfaction with any aspect of the operations, activities, or behavior of public health system or its providers, regardless of whether remedial action is requested. So who produces these grievances? Those are the complainant. Who are the complainant? The person who lodges a grievance can be raised by any patient, their families, or hospital staff. What are the essential feature of this grievance redressal mechanism? What are the first? We should have positive approach demonstrating sincerity and concern toward their grievances. A simple user-friendly system should be there so that easily they can put their grievances. And it is not only that putting grievances is important. It is they have to follow. They should follow up and report. We should report to them for those grievances. It should be time-bound redressed, and mechanisms to give, there should be a mechanism to give feedback to complainant. We have to give feedback after resolution of the complaint. We should maintain their confidentiality, and one-time registration for a grievance, that is one grievance, one registration to prevent duplicity. So whenever a grievance comes, we segregate category wise and we hand over to the authorities, those who can handle those grievances. Those grievances can be non-availability of services, like there can be non-availability of staff, there can be non-availability of drugs or equipments, there can be denial of entitlements or benefit schemes, there can be inadequate infrastructure. Simply they can complain of the infrastructure, like having not availability of sitting arrangements, toilets, or electricity, whatever. They can complain of poor quality of services in the form of what we provide to them. There can be substandard clinical care in the form of complaint of doctors, officers, nursing officers, or any healthcare staffs. There can be administrative procedural grievances, or there can be corruption or bribe, some monetary or non-monetary monetary benefit which can be asked by them, by the healthcare providers. So to overview it, what is the process actually? It is a stepwise process. First step is to receive the complaints from various modes like helpline, forms, online, in person. And after receiving complaints, we have to register them and acknowledgement of that grievances. And after that, we have to we have to do investigation and who is involved in this process. And we have to, resolution of the grievances should be done by the authority. And after resolution, we have to communicate to the patient and we have to follow up, and continuous monitoring is done so that the same complaint should not be repeated. So there are various portals by which these grievances should be addressed, like simply a grievance redressal help desk or some call center or a web portal. A central web portal is very helpful, but if it is not there, we can address by grievance redressal help desk or call center. So again, the process of grievance redressal includes first the registering of the grievances. There is a process of grievance redressal, and finally there we have to resolution of the registered grievances we should have to do in the time frame. So first, registration through a call or online. Then the complainant will get SMS for successful registration and registration number for tracking those grievances. And registration in redressal web portal, SMS to the concerned official. Then it is done. After that, triaging of the grievances for its type and level of redressal, and for the resolution, we forward it to the concerned authority. But it should be whatever, from wherever the grievances are coming, we have to do the time bound resolution of those grievances. And in cases the web portal has not been established in a state, or grievance redressal help desk and a call center are functional, the same format, that is Annexure 3, will be used in the form in hard copy or soft copy on the computer. This is the Annexure 3, which is recommended by the NHM, in which there is one is the details of the patients are there, details of the complainants are there, and we have to see that what is the category of the grievance, and one part is of the office use, whether it is resolved or unresolved, that we have to see. So if in the time frame the grievance is not, resolution has not done, we have to escalate it further to the higher authorities, like from facility level to district level, to from district level to state level, and from state level, if it is not, resolution has not happened, we have to communicate to the state minister level. So up to 7 days we can keep it in facility level, up to 8 to 14 days we can keep it to district level, and after 21 days it can be communicated to, or it can be processed to the higher authority. So how do we implement it? How do we implement this mechanism? So first we have to set the grievance redressal help desk, and we should set a call center. So how do we set the grievance redressal help desk? So when we are setting the grievance redressal help desk, it should be 24/7, it should be operable. The purpose of setting grievance redressal help desk is to address the grievances, to act as an interface between the authority and the public or the complainant, and we should be responsive to the need of the patient, and ultimately the purpose is to improve the quality of the services. The role and responsibilities of the grievance officer is to receive the complaints, to register those complaints, to provide immediate assistance if it can be helped easily, and facilitate resolution 60 to 70% at the local site itself. And if it is not, he himself is not able to do it, he should be escalated further. He should inform the status, and he should give a registration number to the complainant by which he can regularly follow up, and he has to inform the higher authorities, the nodal officer, and he has to display the patient right also at the place where the grievance help desk is there, and to conduct exit interviews, and he has to inform gap to the MOICs. And ultimately the very important part is we have to maintain the confidentiality of the complainant, and we have to, the utmost important is that when the complainant is complaining, we have to be empathetic and caring to the patient. So who has been selected for the facilities for grievance redressal help desk? Those are the medical colleges, teaching institutions, and district hospitals. Those who are having patient load of more than 6,000 per year, or those hospitals who are having more than 100 beds, or bed occupancy more than 60%. And that GR help desk, number of the grievance redressal officer in medical colleges should be 4 to 12. At district hospital, it should be 4, and others, it should be 1. So what is grievance redressal help desk? It actually runs around the clock in district hospitals and medical colleges, and one grievance redressal help desk requires 4 personnels, 3 operators per shift, and 1 coordinator. The task of the grievance redressal help desk coordinator is to coordinate with the nodal officer and staff of the facilities and the complainant, maintain a record of the action taken on the gaps identified and improvements suggested to the nodal officer, and prepare and share the internal reports with the facility nodal officer. The grievance redressal help desk operator register the grievances in the grievance redressal web portal, and they receive the complaints either orally or in the writing form from the patients or the complaint suggestion box, or complaints referred from the call center or web portal. And the unresolved, 60 to 70%, they have to resolve. If it is not unresolved, they have to timely hand over to the nodal officer to address the complaint in the time frame. And how do we monitor the performance indicators for the grievance redressal help desk? That is by the number of grievances registered per month, number of grievances resolved per month, number of grievances resolved on the same day, number of OPD and IPD exit forms filled per month, and monthly reports submitted in the Rogi Kalyan Samiti meeting and to district collector and CMO. So we have to set up call center also, that in 24/7, it should run 24/7. Toll-free grievance redressal helplines should be established at the state level to receive, register, and address the grievances, and offer what are the services which are offered. It has to serve as a grievance registering system. It has to also provide health advice, to provide counseling services, and to provide support to field health staff and other services. But during night time, priority services are only the real-time emergency grievances has to be conveyed to the nodal officer. Some emergency medical advice it can be given, information on any emergency health services, healthcare facilities, and diagnostic centers which are available, including the private one, that they have to convey, and very important information about the blood bank, blood storage centers, and availability of blood bank and ambulance services. So, grievance redressal web portal services which they provide are mainly the grievances, the registration of ASA grievances, the awareness part, and the emergency preparedness and online reporting, tracking, and monitoring for internal users, and the feedbacks. So there are the various patient feedback form, which can be produced in the OPD or IPD, that has been described by the National Health Mission. This is the patient satisfaction form and steps for its implementation. OPD patient feedback, where patient can, there is a drop-down questionnaire is there, and patient can just tick it and they can provide us the feedback. This is the IPD patient feedback form, which we can use in our IPDs. And this is the registration format for grievance redressal help desk, call center, and web portal, which has the patient complainant section and the category of the grievances, and the office use, where we can see what is the actual status of the grievance. So a key components of an effective system is accessibility. First, it is the accessibility. It should be easy, and multiple reporting channels should be there, whether it is online, offline, or direct reporting, but it should be easily accessible to the complainant or the patients. And we have to protect the patient identity. And after the grievance registration, we have to quickly think about the resolution of the grievances, and we have to define roles for handling complaints, and data analysis for systemic improvements. And actually the outcome is to improve, our main motto is to improve the healthcare system. So an effective grievance redressal mechanism must be effective, that is capable of providing appropriate and adequate redress. It should be efficient, that is able to provide redress in a timely and cost-effective manner. And it should be credible, that is trustworthy in the eyes of the citizens, so that the trust should be built up to the healthcare system. So in our aims also, for overseeing the grievances handling, and ensuring process, and ensuring timely resolution, and maintaining records. There are different modes of submission, like online, through the web portals, through in-person. All departments have complaint box and feedback register systems in their department, where the department head is responsible for address those grievances, and those grievances which are sensitive and those who cannot be addressed, that is escalated to the hospital administration. And offline grievances are collected from the help desk and suggestion boxes, which are kept in the MS office or help desk areas, from where the grievance officer collect those grievances, and immediately whatever it can be, resolution can be done, he himself does. And after that collection, he informs hospital administration, and hospital administration then distribute according to the concerned authority for the resolution of the grievance in timely manner. So these are the grievance redressal. These are the suggestion boxes which are kept in OPD, IPD, MS Office, help desk, various areas. These are our suggestion forms. This is the grievance portal, web portal. Online portal is also provided for the patients to give their feedback. And in emergency also we have emergency nurse coordinator who look after the all complaints, and feedback register is there where the patient can easily give their feedback for our improvement. So we have till now we have addressed 1897 grievances successfully with effective solutions. So what are the challenges what we face in implementing these grievance redressal mechanism? That is, first important is the lack of awareness among the patients. That also we have to create awareness between the patient to give feedback so that we can improve our healthcare system. Delays in response and resolution from our side. So we have to the time bound resolution is very important, and resistance, mostly there is a resistance to feedback from the staff, and data management and security issues are there. So these are the challenges which should be taken over. And ultimately, to conclude upon, strengthening the patient communication channel is very important, and implementing strict monitoring and follow-up protocols, encouraging a culture of openness and responsiveness, and using technology to enhance the efficiency of grievance redressal mechanism. So these are my references. I have taken it from guidelines for establishing grievance redressal and health helpline from MOHFW, and the patient safety implementation framework, and the grievance redressal mechanisms for health sector in India. So we at AIMS Raipur, we strive for achieving we have patient safety culture under the guidance of our eminent, under the guidance of our Executive Director, Sir, Lieutenant General Dr. Ashok Jindal, Sir, and under the guidance of our Chairperson of Patient Safety Committee, Dr. Tripathi, Sir. Thank you, Dr. Tripathi, Sir, for guiding me for making the presentation. And we welcome you all for suggestions and inputs for enhancing the feedback mechanism and grievance redressal mechanism. Thank you.
Thank you so much for this insightful presentation and very minutely covering all the different aspects which are critical for grievance redressal. And of course, it would have been a learning, a lot of ideas the institutions who have joined in would have got as to how they can strengthen grievance redressal mechanism in their own institutions. I think while the other speakers are asking the questions, one of the questions which I found in the chat box is what are the mechanisms for discouraging false and malified grievance? So, if something, I think, ma'am, if you would take up this question.
Sir, there are several laws which
Yes.
can protect us in these maleficent grievance. So the positive feedbacks mostly we take, and we try to resolve it in time frame manner. But there are several laws which are there to protect us from from these
And
maleficent.
definitely, this thing we need to accept that this is a kind of a positive thing that we have a grievance redressal mechanism, but many times false and malified grievances also crop up there. So this issue is of course there, and as a team, most probably the patient safety committee of the particular hospital, along with the administration, they can of course take a call as to how to handle these malified grievances.
I think there should be a law for these negative feedbacks, which should be included in our patient safety handbook and all that we can be aware of.
Yes, ma'am. We can work on that. Something like that. It should be worked on. And I that one that multi-centric study. I came to know about that. You are trying to you have planned a multi-centric study regarding the grievance redressal mechanisms in place in the various institutions. So I was going through that protocol. we can have it in different medical institutions, I think, to just to know what are the issues as of now, and then how we can effectively get some of the ideas from the institutions from in resolving them or something like that, to have a robust structure.
Yes, sir.
Yeah. And while we talk about grievance redressal, equally, we wish to also emphasize that patient safety is something wherein the patient and the caregiver are the equal partners for care. And while treating physicians or the healthcare providers, it is our responsibility to empower the patient in terms of self care, taking care of the cell, maintaining hygiene, medication on proper time, getting the diagnostic test done, whatever follow-up care, everything is there. So the patient as well as the caregiver, both need to be conscious about their keeping themselves healthy, as much as the intent for good service is there by the healthcare provider. So I think next webinar for the audience, I wish to convey that on 2nd April 2025, that will be our 12th webinar of the webinar series, and that will be on roles and responsibility of the patient as well as the caregivers in patient safety. And the experts will be from AIMS Gorakhpur. And for those people, yeah, thank you, Avdesh, for putting up this on the screen. And the experts will be drawn in from AIMS Gorakhpur. And just for those those audience who have joined in new, this on first and third Wednesday from 3:15 to 3:45, the National Patient Safety Secretariat, Ministry of Health and Family Welfare, we regularly organize this capacity building webinar, wherein every fortnight we discuss upon the various pillars of patient safety, right from medication safety to surgical safety. Now we are talking about grievance redressal, then we have awareness, IEC, healthcare associated infections, so on and so forth. So it is an attempt for us to spread the idea about patient safety and how we can have good patient satisfaction in terms of care delivery from the public hospitals at large. And before we conclude, I would also like to acknowledge the technical support in terms of background work and IT support and everything from Eco India, who partner us in taking this webinar to all the medical colleges in the country. And Avdesh ji is there, who is always with us from Eco India to help us through this.
Thank you, sir.
So,
Thank you so much, sir.
yeah, thank you, Avdesh ji. And uh, thank you, Dr. Pranita ma'am, once
Thank you, sir.
again. We will continue to look forward for your guidance
Thank
time and again. And you are also one of our medication safety experts also. And I think medication safety guidelines also, we are almost finalizing. Within a week or two, we will be able to release them as well. So, Avdeji, I think now it is already 3:44, so we can wind up.
Yes, sir. Yes, sir. We can wind up. Already we are
Okay,
extending the time.
okay. So, my sincere thanks to the audience who all have joined. Thank you, everyone. Thank you to the expert speaker. Thank you, Avdeshi.
thank you, sir.
We
Thank you
can
so
log
much,
off.
sir. Yes, sir. Yes, sure, sure. Thank you, Dr. Avinash, sir, and thank you, Dr. Pranita. We
Thank you,
can
sir.
wind up. Thank you, the
Thank you,
audience.
Avdeshi. Thank you.
Thank you. Thank you, ma'am.